at a point during my training, I went to Japan. And when I was finishing, they were telling me, oh, please, make sure you come back and practice in Japan. I told them, okay, no problem, I'll think about it. But when I was coming back, I asked myself, must every good thing be with the whites? The answer is no. I don't know if it is still on my status now. I used to write it in my status and my WhatsApp. I would say, dear Africans, sometimes you too have to be the first to do something new. So we cannot continue to leave the best for only the whites. I'm not saying that they shouldn't have good things, but every good thing should not be uprooted from Africa and planted in the lands of the whites. We're also good and we deserve the best. So, on coming back, I told myself, I went to Japan to have more skills, to learn more skills, but I'm giving myself 25 years to make it be that in 25 years from 2019, any African, any Nigerian neurosurgeon that is going abroad to go and learn is going there not because there are not enough things to learn with here, not because there are not enough patients, not because there are not enough skills here, but because it feels like going. That became something I have to work on to create that standard of care that is like those ones, or even better than those ones here in Nigeria. But of course, as you know, you may have the vision and you don't have the power. And in government institution, though I had the vision, I didn't have the power. It became necessary for me to be in the private sector too, to be able to put that in place. I tried to reach out to some persons, it was not possible. Then I had to join a team, a hospital which I've been part of the onset since like 2012 thereabouts. I left it 2015, handed over to other persons, and I went 2015 to 2020. By the time I came back, everything was down. But I said, we will start from here. And we started. Today, I can tell you that we are a hospital to be reckoned with. I wouldn't want to make a statement to look like we are bragging, but I can tell you that when it comes to service, when it comes to outcome, when it comes to what we do, we should be among the best in Southeast Nigeria. Those things that people are going abroad to go and achieve, we make sure we put them here, so you don't have to go abroad. If you are going abroad, you are going because you like a bigger space, which we have not got. We also try to make sure that medical personnel, doctors and specialists who would have traveled abroad because of not having adequate work environment to work, we created adequate work environment for them, both for the kind of administrative and clinical support they need, and also the financial support. And we've been able to achieve that. I can tell you of a truth that for a long time, and even till now, for the past 3 years, we have hosted the only cardiothoracic surgeon in Imo and Abia State. When that person said when she finished and told me she's leaving Nigeria, there are so many places where they are going to pay her better, I told her, please, Nigerians also need cardiothoracic surgeons. Just like I'm a neurosurgeon and they need me, they still need cardiothoracic surgeons. Please stay. Said no, they cannot pay her money. I said, how much are they paying people there? She told me. I said, okay, don't worry, I'm going to organize it. How much is government paying you? So the rest that it will require to make up with what people are getting there, organize it somehow. you'll be getting an amount that equates to what you would have got if you had traveled there. It was not easy for us. We were losing because it's not every time you have patients. But when we started we'll put things together. So at least at the end of the month, she wouldn't say, "Oh, my friend there is any better than me." We've done this for different specialists, so they continue to be here. Me as a neurosurgeon, I handle brain and spine, and also handle critical care, because in the course of my training as a neurosurgeon, I did critical care training, so that a patient, no matter how bad that patient is, will be able to sustain the patient and keep the patient alive for a time long enough for the primary specialist or the primary team of specialists to be able to get the patient out of the bad condition. Now, when it comes to neurosurgery, anything that has to do with the brain, the coverings of the brain, the spine, and the spinal cord and the nerves, by God's grace, God has given me the opportunity to learn knowledge, skills, wisdom, and we have been doing much in that area. We do spine surgeries, we do brain surgeries. Some people will come and say they don't want surgery at all. They don't want surgery. They say, "Oh, this need requires surgery." They say they don't want. Yes, we don't throw them. We say go. We still tell them, okay, if you don't want surgery, fine and good. The principle that the surgery is trying to achieve for you, we'll try some other ways. We have been able to treat some of them who have vehemently refused surgery, despite surgery being the best option for them. We've been able to treat them and have sustained them very well. If you come here on Wednesdays, which is my follow-up clinic day, everywhere is busy. Most of the people who are coming are those ones who would have needed surgery, who don't want surgery, and then you have to still look out for ways to manage them and make sure that they are well. Occasionally, some people want surgery and they get it done. We save a lot of people. Very many people we save. We lose some. But I must tell you the truth. If a patient dies here in Mark of Glory Specialist Hospital, that patient would have died anywhere else under such circumstance, because we have the personnel, we have the machines, we have the dedication, we have the materials when it comes to the drugs and all of that. Just like I was saying before he stopped me earlier, I said those drugs that are present only abroad because they are expensive or because they are not, whatever reason, we have them here. For example, if somebody has a stroke and presents within 1 hour to 2 hours or thereabouts, there are things that are given to them in places like UK, US, and to dissolve whatever is blocking the brain, and the patient will start moving the next day. We have the drugs here. The same drug. Sometimes when people have heart attack, cardiac arrest, when there's a heart attack, we have it here. Sometimes we have these drugs not knowing if any person may come and use it, because many times Nigerians will not come to the hospital early, but we'll keep them because that one life that may need it and we don't have it is important. That one life that will come early and is unable to get it, that life is important. Yes, they may be expensive, but I tell you the truth, the life is more expensive than the drug. The best form of antibiotics, as the world knows it many times, Meronem. We have them, and in that case we get them directly from the company. We understand that in recent times people have started adulterating them, but you know what we do? We go straight to the company to make sure we get them. Most of our drugs are obtained directly from the companies to make sure there are no adulterations. We use specialists and we use consultants. Many times we use consultants. I understand that in some cases, some places may not be specialists, but if you come to a hospital, you can't ask the doctor, show me a certificate. If they call him doctor, you say okay. But we use the best and the qualified specialists. So we say we're a consultant-based multi-specialist hospital. Consultant-based private multi-specialist hospital. Because the consultant has the knowledge, has the skills, has the sense of responsibility. In fact, with this knowledge about us, some HMOs have recognized us in that point that they make sure that only their high profile patients they send to us, like Asa Masad. Asa Masad recently has upgraded us to the point that only gold patients, gold, diamond and platinum, those are the ones that can access our service. So if you are bronze or silver, you cannot access service in Mark of Glory. You may still be allowed to access service in some other places. What is the reason? Because in Mark of Glory, we don't cut corners. That issue of not cutting corners is significant. I told somebody that yes, my father should be about 100 years or thereabout now, but I know it's more than 90. If he's sick today in my town in Owerri in Edo State, the earliest time, if it's critical, the earliest time and earliest means I think I can move in down here. I'll move in down here because I know that in this place, both protocols, personnel, machines, and everything are present. As at now, the only thing you can say you will not find here is space. I agree with that, but I tell you the truth. God is working in our favor, and sooner than later, we'll have bigger spaces. So I would advise you and appeal to you, please continue to work closely with us. We are ready to work very closely with you. If you have any person that considers health care, then the person should consider Mark of Glory Specialist Hospital, because we don't cut corners. Yes, it may be more expensive than some other hospitals, but I can tell you, compared to what we give you, we are the cheapest. If you consider the service you get from anywhere else versus what you pay, consider the services you get from us versus what you pay, we will still be the cheapest. If any person will give you services like we give you, I expect and I have seen that such persons will not charge you less than 3 times what we charge you. So we are not too expensive, but I'm not saying that it's just something you just put your hand in the pocket and come and pay. But whatever you pay is worth it, because I know that it is better to use your life, to use your money to save your life, than to use your life to save your money. I know many people try to use your life to save their money, but that is usually not the best, because when you use your life to save your money, those who you leave the money behind for will squander it. So please, you are all welcome here. So we have come for being very good to Umise people. We've been very good to Umise people, and we promise to be much even good for them to them. In as much as some time ago he was mentioning something, we had a very bad experience with a particular family. I'm sure some of you might have seen it online, whereby we'll be treating their mother since she was 77 or thereabout, and by the time she was 83, she was. In fact, the woman is just brought here by the caregiver, and we treat and send them the bill. They pay later. And for your April 17th, April 12th summit, we'll be very willing to partner with you and support you in every good way. Then thank you for the honor, and thank you for considering us for everything that has to do with honor. We'll be willing to accept every form of good honor. By God's grace, this honor, a lot of persons have been noticing us, and they'll be giving us different forms of honor. Then by God's grace, I think this has not come out in media, but by God's grace, we also have to get honor from some
chieftaincy.
Yes.
Okay, that's good.
You should be putting it on now. Chief Dr. Mark.
We want to celebrate it when we get to a larger space.
All right.
You understand?
Okay.
So that's by God's grace. They said the title is Aku Gochugo Jaguaria 1. Aku Gochugo Jaguaria 1.
That's nice.
So we realize that a lot of people are seeing the good things. So because of those people who are seeing the good things, we only remember those who do bad and forget. We remember them to forget, and we'll continue to forge ahead. I believe that 25 years goal will be met. That's by 25 years from 2019, Nigerian neurosurgical field will be so developed that our neurosurgeons will no longer need to travel abroad to go and learn. And I wish to be part of that. Now we've started doing things like endovascular neurosurgery, whereby you want to operate on the brain, you just go through a vein in the hand or in the leg. So we started doing endoscopic and all of that.
Wow.
So gradually we'll get there. So thank you so much. So I don't talk too much.
Okay, so at least we can see your facilities now.
Yes.
All right. Okay.
Yes. Yeah. The CPU, Central Processing Unit.
Yes.
Central processing.
This is the brain of the organization. This place. Yes. This, which is our technological arm of Owerri Group of companies.
Okay.
Excuse me.
A private room, as private was one. Now on this side we have pharmacy store. You look, cartons are all from up to down, drops. You have medications, but dispensing doesn't take place here. You just store here. Pharmacy store one. Then on this side you have the labor ward for patients who are in labor. Though we don't have them too many in this place, because people think we are just for critical patients. But we actually handle labor cases too.
Okay.
Now the clinical administrator. Remember I told you about the cardiothoracic surgeon?
Yes.
She happens to also be our clinical administrator now. So, and for you to be a clinical administrator in Owerri Specialist Hospital, you must be a consultant. So she's a consultant cardiothoracic surgeon. They open the heart and repair it. Open the lungs and repair it. On this side that we are going to, this is the inpatient side. We have different areas here. Now, in this place, this is pharmacy store 2. It's not pharmacy store 2 because there's not enough space in the pharmacy store 1. We have to keep some things in pharmacy store 2. And then this space you are seeing here, this space is used for academics, nurses conference area. So, because we believe in expertise, we make sure that there is routine academic that takes place So they stay here, they learn at least twice a week. Learning is done Friday and any other day that is flexible. So now, this space that you are seeing, this office you are seeing now, it used to be for the human resource manager, but now it's for our legal practitioners. We have in-house legal practitioners because occasionally we've continued to have people who will come and say, please, I don't have, and then you want to pity them. But you also remember that these same people that come and say I don't have today are the same people that will come back and fight you tomorrow. So we have our legal practitioners who handle anything that may have to do with legality or agreement inside. Let me see if they are in their office now. Is there anybody here? So now these two words, word 1 and word 2, these are words that we call general words. They are for patients whose tendency to die is minimal. So when a patient has been admitted in a critical situation, the patient is kept in HDU. General ward is for patients whose conditions have improved and are likely to be discharged. So most discharges take place from general ward. So we have them here and we have some here. Now this side, beyond this mark, you see HDU, high dependency units. So it's for patients whose conditions are very critical and have tendency. So here you have different patients, and every patient has his own nurse. That's one other thing in our laboratory. Every patient with his own nurse. Every patient is his own nurse. No, it's not everybody's. You cannot be a nurse to everybody. Okay. You have your own nurse. So your nurse is by your bedside. If you notice it, we don't have nursing station. The station, your station is beside your patient.
That's right.
So the only time you will not see the person beside his patient is maybe he goes to pick up something and then he says his neighbor, please look after the patient. Now, these are 4 beds and these are currently the patients we have there.
Okay.
Then in this place, this is also another interview, but patients that are kept here, mainly young children or those who do not have space in other places. Now, inside here too, we have places for premature babies.
Okay.
So, take a look at this.
So this what?
Premature baby.
Yes. This special care baby unit. You can see incubator. Incubator for baby that's not mature before baby was born.
Okay. Babon Bisa. Senator.
How are you?
So she's ahead of nursing section. So in our nursing section we have 4 departments. We have the critical care nursing department. They are the ones that work in high dependency unit, intensive care unit, and emergency. Then we have the family care nursing department. They handle the general ward, they handle antenatal, handle labor ward, handle immunization, handle OPD. Then we also have the dialysis nursing department that handle dialysis, and then we have the perioperative nursing department that handle surgical matters. The nursing manager.
Thank you.
The coordinator of our legal outfit. Okay. They are the ones that use our office.
Nice to meet you.
Barrister Juliet Umbata.
Okay.
to stay.
Okay, so
I said our patient relatives, they don't have to stay with their patient because they don't need to stay.
Okay.
The nurses does everything. We only give them information of what we want to do. So a person that admits his or her brother here can actually go home, go to farm. If I travel, that's why Ogbona's family. That's why Ogbona's family were able to have their mother here for 12 days without any of them coming here, and the woman was fine. All we just needed to be doing was to inform them, okay, this is where we are now, this is where we are now.
what are the duties of this nurse or nurses beside them?
The nurses monitor the patients, feed the patients, bathe the patients, give medications, communicate with the doctors in cases of any change, communicate with the family members in cases of any information or decision being taken, cleans the patient when the patient poos. Yes, nurses clean the patient poos. The nurses take the patient to the toilet. In fact, if you are a nurse and you are seeing that your patient relative is feeding your patient as easy as feeding, you are in trouble. Not talk about cleaning the bum. No, the nurse does all those things. And of course, the nurse also makes the patient happy. Plays with the patient, laugh with the patient. So we say that the first patient relative that our patient has is his nurse. The second is now the patient relative. So, and after every shift, the nurse hands over to another nurse, who will hand over to another nurse, and everything continues like that. So if somebody comes here, the only complaint any person can have by coming here is that he could not, maybe the space was not big, or he could not pay the bill. But when it comes to care, the care is excellent. That's why I tell you that if somebody dies here, under that circumstance, that person would have died anywhere else. So the infusions, we get it directly from the companies. So because of space, we have to keep these ones here. Why do we get it directly from companies? Because we don't want adulteration. There are a lot of people out there who just want to make money and they don't care who dies. But we are sure if we get it directly from the company, it will not be adulterated. So that's why we do that. Solar power plants. And this is EEDC power plant. At the back we have the diesel gen. I'll show you the diesel gen when we get there. Now, one thing is peculiar. We have two diesel gen there, 150 kVA. If anyone gets bad, we will not start using the other one and wait to repair that one. We will go and hire another one. We will go and hire another diesel gen because that one too that we are using now can have a fault. So we'll hire another one and keep and be repairing the one that is spoiled. So that if for any reason that one, if for any reason that one that is there has a problem, there is also another backup. So that is what we do. So because there are sometimes you need some things to use electricity to keep somebody alive. If you don't have that electricity, the patient can die. For example, you see that machine. Hey, who is that person? It's you know. Point to that machine. Yes, that machine is called suction machine. If a patient is choking, you require that machine to use to suck the thing out of the patient's throat. If there is no light, that machine will not work. So, a patient may not know what the risk you are taking away from him by making sure that there is always light. That machine will have to use it to make sure that that patient doesn't die at that time. I have heard of patients who died because there was no suction machine in certain places. Of course, we cannot mention any place. Now, this is our oxygen plants. You see, these are oxygen that are full. These are the ones that are empty. I especially hear people say that my brother oxygen can't finish. They say make I go find oxygen. The mark of Owerri specialist hospital, oxygen not dey finish. Before he finish, we don't replace them. Sometimes towards the end of last year, oxygen became scarce. People had to go to Benin, Port Harcourt, Uyo to get oxygen because the oxygen plants here went bad. We still have to make sure that these are done because human lives are involved. So we believe that one life is too expensive to lose. No matter what it costs you to save a life, save that life. At the back here is another private ward. Remember we have one private ward? Yeah. Another private ward. Then the doctor's call room is there. So that at any point in time there's a doctor around. And we don't use student doctors, so we use a doctor that has finished his house machine at least and now has full license. This place is emergency entry area. This is emergency entry area. So if we have an emergency now, they will ring a bell. Okay? Go and ring the emergency bell. So once the emergency bell is rung, everybody knows who and who in each section should come out for emergency. Okay. You hear it? Okay. So once the emergency bell is rung, people start moving towards the emergency. You see, someone is asking for emergency. You understand? They start moving towards that center because the emergency has to be sorted out as an emergency. So when the emergency comes in here, you keep the person in the emergency area. I use the emergency area. So now the emergency unit has a nurse sitting down and waiting for the emergency that has not come.
The emergency that is yet to come.
Emergency that is yet to come.
Okay.
There's a nurse put down there in case there's emergency so that you won't say I was doing another thing. Okay. And now you see machines that are staying here waiting. This is a patient monitor. Some hospitals may not even have one of these. Even some very big hospitals may have very few. This is one that will just be waiting for a patient. Now there's no emergency here. But you see the machines are already there. This oxygen waiting for a patient that is here to come. This woman may stay here from morning from all through her shift and no emergency came. No problem. We still pay her for her job. This is how we prepare for emergencies. Now let's move on. Okay, that place is open. Okay, let's look at the intensive care unit. Now, these are intensive care units. Right now, there is no patient in the intensive care unit. That's a life support machine. That's another monitor. That monitor you are seeing there, if you see, doesn't have a stand. That one down there. This one. This one we use it for emergency mobilization. Sometimes we are called that, oh, a patient is about to die in one hospital somewhere. Please, can you come and take the patient? Because usually they will call us, please, a patient is about to die here. Can you come and take the patient? We'll move with this, with oxygen, with everything, with a critical care nurse. Because nurses are trained for critical care. They'll go and pick up the patient from anywhere. They start treating as they are coming. And in some cases, when we are to move a patient down, we don't even tell the patient to pay. Just that, okay, they are willing to move, we'll go pick. We'll start treating because as they are coming, they are talking to the doctor. The doctor tells them, okay, do this, do this, do this, do this. They go with drugs. They go with all sorts of machines. Inside this cupboard are other machines that are used. This machine now is a cardiac pacer and there's a defibrillator. Let me see something. So this one now, when the heart stops, you can use it to restart the heart if the heart still has some little life in it. Different machines are inside. I'll not be able to start saying all of them well. That one. This one?
Yes.
This one is for breathing. A patient has stopped breathing. You put on this one, it can help the patient to keep breathing for as long as the heart is still pumping, the oxygen will keep circulating until you are able to pick up the patient again. So sometimes you see it, when you connect it, they say, okay, is the patient making his own effort or not making his own effort? So gradually when patients start making his own effort, you wean him off. It's called mechanical ventilator. On the layman, we say life support machine. This is another monitor. You can see oxygen there. That's the dialysis machine. If you take note of something, everywhere you get to, there is a nurse. Usually, that nurse is one of those who specialize in that area. So these are dialysis nurses. Now this is a biomedical engineer and dialysis technician. So we make sure that we use qualified personnel. So So they are waiting for a patient that has not come.
So this is where?
This theater.
Okay, the nurses are waiting.
Yes.
For patients.
Yes. So patients are here to come.
Okay.
So this machine is, we call it CN. If you are when we are doing spine surgery, any surgery that has to do with bone, with this machine we'll be seeing inside the bone while we are working on it from outside. There's another machine there, an aesthetic machine, many other machines. Hey, you may not be allowed to enter too much because of sterility.
Okay.
So an aesthetic machine, dietary machines and all that. Now can you see that machine there, that one that is red? Now please point it. Yeah, that one that is red. That is and we call it AED. Alternative external defibrillator. It's also used to restart a heart that has stopped. Do you understand? So you see there. Then here we have a private ward. Dialysis is pure and purified.
So you said it's water
Treatment plant. In the other place is where we used to have a petrogen when we were still small before we grew bigger.
Yeah.
Okay. And then we still have washing machines around. Now, seeing or doing for theater. In that publication that Samuel wrote, he wrote that we do not use sterilized equipment, that we don't have things to sterilize things. But Samuel has never been to Mark of Brain Specialist Hospital.
So this is
Sterilizing
This is for sterilizing, autoclave. This is a 150 liters tank, and I don't want to mention that many places don't have this size, and we don't just have one. We also have another smaller one for backup. In case there's need for any issue, you have a backup. Now, let's go. There's more. Okay. Now, when the patient is brought here, if the patient has an MRI, X-ray or anything, so you see, we put the X-ray here to view it. Is there any X-ray around? Is there any X-ray around there? So for example now, let's say, assuming this, I think this somebody's own that he has left long ago. So the person comes in here like this, just put this here, you view it, you take decisions, and you start what you want to start. All within the small space.
okay.
See machines. Now recently we have got another machine, we call it portal ECG machine. It can do ECG for 24 hours. You just attach it to the person will just be moving around to be checking the heart for 24 complete hours. If you want to extend it, you can. Not like you are just lying down. The ECG that most of you know about, you just lie down and just do it, you go. But this one is total ECG. For 24 hours, they are attached to the person. This ultrasound scan that you are seeing here, this one can do what we call 4D ultrasound scan. As they are doing it, they'll be seeing the baby's face for the one for pregnant women. They'll be seeing the baby's face, so you can know the shape of your baby while the baby is seeing the womb. So if you are able to identify it very well, you may know whether the baby resembles your husband or resembles you. Do you understand? And of course, we use qualified personnel. That's the head of imaging pattern. Okay, Chi. How are you? Yeah. She's imported, though. We imported her from another state. All right.
And she's from DC.
She's from DC?
Yes, she's from DC.
So what did you go and do in that state where we went to import you? It's okay.
Thank you, sir.
All right.
Thank you.
So a person just wears it and just can you raise it a little?
Okay.
Yes. So we wear it. After 24 hours, we go and read it.
Okay.
So assess the heart function.
So what does this do now?
It's, now when you go and do your ECG normally, within that short time, some abnormalities may not be picked.
Okay.
But for 24 hours, if you do this 24 hours ECG, you'll be able to pick abnormalities that you not have picked in the normal ECG that you do within 2 minutes or 3 minutes.
That means he can go out from here to any other place.
Yes,
and
yes,
still return here.
yes. So now this is physiotherapy and rehabilitation. So this is one of our physiotherapies. So you see, we have something under the. These are different machines. From under to middle to top, all these are machines. Fully automated laboratory. The only thing we do not have is space. Now, these are qualified personnel, scientists. Scientists, listen. Yes, that's another scientist. This is a technician.
Okay.
So we don't overburden the scientists. We still make sure that they have technicians to work with. We don't just leave the work to technicians. We make sure that they have scientists overseeing them. And this laboratory is also being supervised by a consultant chemical pathologist, Dr. John Owerri. He's a consultant chemical pathologist. He oversees the lab to make sure that anything that you can think about medically is in order. You know, sometimes they say lab bring bad results. Bad result doesn't come from this lab. In fact, this lab has its own special name, Joy of Life Diagnostics. If you notice it, it's a Joy of Life Diagnostics.
Can you compare the result that is gotten from this lab to that gotten from Everett?
You know, because this is medical practice, I don't want to make any statement, but I can tell you that compared to any result anywhere else, this lab is good. I don't like saying better because you'll be accused of being compared. You are going to say you are comparing with somebody. In medical practice, we don't really compare.
Okay.
Now this is a blood bank. So this blood bank serves both our hospital and any other hospital that may want blood. And we have blood. We run this lab 24 hours. That machine in there is called iStat ABG machine, arterial blood gas machine. That machine can give you a result in 2 minutes. And that machine is almost 20 million. So that machine you are seeing there can buy a car. That's the same change. Small box. That small machine you are seeing there that looks like. But instead of using such money to go to somewhere and buy a big land and build a big building so that people say, wow, 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 we choose to use the money to save lives. Many hospitals would not have this, and they do not have. It's not their fault. It is how you choose to channel your resources. There are so many others everywhere.
I was waiting.
You have that's a scientist, that's a pharmacy technician. Sorry, that's a pharmacist. That's a pharmacy technician. I think some other of their staff must have gone out for something. So they are here. We have a pharmacist qualified and has worked in places where they produce drugs before. So make sure that the drugs we have and use are okay and excellent. Like when I told you about a drug that you can use for stroke within 1 hour, we have them here. If we say we need it now, they'll mobilize the storekeeper in 3 minutes. You will see it in your hand. So that is what we do here, quality. And of course, if you turn to your back, this is the side that people don't like to go, especially when they are to give them. But if you have to collect from them, they like to come here. Finance section. We have the financial administration department and the revenue. Now take a look. Doctors are sitting down, waiting for patients. These are doctors sitting down, waiting for patients. We don't want a situation whereby patient will say, "Oh, I came, there's no doctor." So these doctors you are seeing here, these are emergency and general practitioners. We have about 11 of them. Okay, 12 now in this hospital. 12. Then aside them, we now have about 30-something specialists, of which I'm one of the specialists. I'm a consultant neurosurgeon. We have consultant cardiothoracic surgeon, consultant nephrologist, different subspecialties in different areas. Some specialties have more than one. Oncology for cancer, urology for prostate, nephrology for kidney, different ones. So anywhere, and once you consider healthcare, then mark of glory. So this place is our customer service department and reception. Okay. We put them together. Yes. So this is the head of our customer service. Are they not? No. You have one nurse. Okay. That's the outpatient nurse. Okay. Because our eyes are supposed to be here watching patients. And know which patient is likely to be having an emergency, because this place is not for emergency. So if you notice an emergency here, you move the patient to the emergency area immediately. So emergency will continue there. But for the customer service, they just make sure that the customer is satisfied. Any customer that is not satisfied now, anywhere the customer is not satisfied, we hold her responsible. So she works with her team. Then at the end there are the revenue officers. That's the acting manager revenue department. Is that right? So payments are made there. You can see the revenue payment points. With the heat of the sun, when you get in here, you relax and your mind will cool. And then this is another consulting room. So this is a consulting room for patients that need to be examined with a couch. And then there's something we see. I give to you. So everywhere you can see here is our parking space. Okay. Across, so on this side though, along this side though, is our parking space for now. When we move to a bigger place, we will have places to be. So this has become a very important place. People are always coming around. Now this person that is coming, I'll tell you about that. This is Tom. These are speech therapists. So when somebody has difficulty in talking, it's the person in that unit that makes sure that the person is taught how to talk. See, we specialize down. Even to when you are not talking well, we give you a speech therapist. that helps you on how to talk. She's in that field. So you see everywhere, and I can tell you that there is more we can do with more space. So I don't want to say too many things on the camera, but they will be shown with time when we get more space.
And you set a special like this on top.
Amen.
And I believe when you get more space
For the tour.
It's okay, Dr. Mark and co, I will put it that way. Thanks for taking us around the hospital, the specialist hospital, then giving us an idea of what each of the facilities, what these facilities do. We thank you so much for opting to be part of the MBC Media Professionals, Federation of MBC Media Professionals, who have come to pay you a visit, who have come to find out what you do here. We thank you so much. And then God will continue to bless you, bless your handwork, and bless all the people you work with. This place, we say, let God continue to use this place as a place where lives are saved, not where lives are lost, but where lives are saved. So we thank you so much and remain blessed. Of course.
So she plays.
My son. I was